Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, why people are dying in custody. I speak with Dr. Roger Mitchell, the former Chief Medical Examiner of the District of Columbia. Dr. Mitchell has observed that when it comes to understanding the reasons for deaths in custody, the usual rules of autopsies and death investigations don't always seem to apply. He's leading the charge to understand more about what's happening. Let's listen. Dr. Roger Mitchell, thank you so much for joining me on Public Health on Call. Most people may not be aware of the strong connection between public health, my field, and forensic pathology, your field. Can you talk a little bit about what a forensic pathologist does?
Josh, it's so great to be here with you on your podcast. I'm really excited. Forensic pathology, in short, we sign death certificates. We determine cause and manner of death, particularly in violent or sudden and unexpected deaths. And anybody that has done public health work knows that we rely heavily on the death certificate to understand the burden of disease and why people may be dying from injury or disease. So the connection is quite clear between forensic pathology and public health is through the death certificate.
Yeah, and I can say that there have been many advances in public health that have come about because of people in the public health field spending a lot of time with forensic pathologists and figuring out why people are dying and using that information to prevent deaths. Now, I want to ask you about some work that you've been doing. You served as the Chief Medical Examiner for the District of Columbia. You are the Chief of Pathology at Howard University now. And you have looked at many deaths in the course of your career. And yet, when you were looking at deaths of people in custody, something didn't seem right to you. Can you talk about that?
You know, I've been looking at death in custody since my times in medical school. I was a first-year medical student, and Amadou Diallo got killed by law enforcement in New York City. And that really sparked my interest in understanding why people in custody, whether it's arrest-related or inside the jail, why individuals were dying that were associated with the criminal legal system. So much of my career, I've been looking at being a medical examiner in multiple cities. I've been looking at how people are dying in custody. And so they die for many different reasons, whether it's homicides, suicides, accidents, or undetermined.
It seemed that starting from a very naive place, that determining the cause of death for someone in custody shouldn't be different than determining the cause of death for anyone who died.
Often it's not, but there is a subset of cases that I'm seeing where there's an altercation with one or more law enforcement. And those manners of death are routinely called accidents or undetermined when there is clearly significant force that may have been applied to that individual. There was a recent article in the New York Times last year that won the Pulitzer Prize talking about sickle cell trait being utilized as a diagnosis for sudden death of individuals that were in an altercation with law enforcement by medical examiners, which really shows the discordance between real cause and manner of death and what we see in deaths in custody.
Yeah, well, so let's talk about that a little bit more. I learned in medical school that sickle cell trait is really just a gene that somebody carries around with them. It doesn't affect their lives really at all. And yet what you're saying is that is being attributed as the reason for someone dying in custody?
Yeah. You know, it's surprising. I learned the same thing. 1 out of 13 African Americans have sickle cell trait. There is some case-based literature that suggests during high altitudes and during high intense sports or while a military recruit is going through basic training, those with sickle cell trait may be at risk of a sudden collapse and then death. But there has been no literature that suggests that sickle cell trait by itself can cause death or sudden death. And even the American Society of Hematology came out with a statement right after that New York Times article suggesting that sickle cell trait should not be used as a sole cause of death for individuals while in custody in an altercation. And so that is just an example of why we should be looking at deaths in custody and just ensuring that we have adequate and proper causes and manners of death being attributed.
What other unusual causes or differences do you see with deaths in custody compared to deaths that aren't in custody?
Well, the majority of deaths, so for example, if I'm a 80-year-old woman and I'm walking down the street and an assailant comes and puts a gun in my face and says, "Give me all your money." And as the 80-year-old woman, I clutch my chest and breathe heavily and then have a cardiac event and die. And that individual did not even touch me. In most jurisdictions, if not all jurisdictions, that case would be called a homicide. The manner of death. We have 5 manners of death: homicide, suicide, accident, natural, and undetermined. And so that suggestion of force, right, resulted in a cardiac event and therefore called a homicide. We have numerous cases of multiple law enforcement officers fighting, beating, restraining individuals, and them going into a cardiac arrest, whether it be from the stress of the altercation or some asphyxial component because of position. There are organizations and medical examiner coroner systems in this country that will call those cases accidents or undetermined as a matter of philosophy, as a matter of culture, and as a matter of routine. And it is my suggestion that these cases are homicides, just like the 80-year-old that clutched her chest in the previous example.
Could I just ask you to explain a little bit more about the term homicide? Because a lot of people think of homicide as something that you only figure out if there's a court case and the jury says it's a homicide. If somebody dies in a fight, how do you know who was responsible? Why would you say it's a homicide? Could you help us understand that?
Yeah, so a simple response to that is if his death's at the hands of another, if another human being's action contributes to the death, really no matter how small, intentionally or non-intentionally, we tend to call those homicides, especially if it is if it's clear that the actions led to the death. But for those actions, that person wouldn't have died in that moment, right? And so homicide is a medical term that says deaths at the hands of another. It is not the legal term of murder, which is designated in the court of law.
Got it. So by saying something is a homicide, you're really describing, in a way, how someone died, not guilt or innocence per se.
And that goes for all manners, Josh. All manners are to establish the circumstances. So if I say it's an accident, that to the reader says there were circumstances of an accident. Suicide, natural, homicide, and undetermined all depict the circumstances surrounding the death.
Just one question. When you say they found some sickling in the autopsy on the slides, you're saying that it wasn't enough to factor in the death?
That's correct, because post-mortem, after death, you can see sickling of red blood cells as a function of death in individuals that both have trait and disease. There's a clinical trajectory that you need to solve for if you're going to give someone the diagnosis of sickle cell disease or sickle cell trait that may cause death. And it's still not clear. And there's nothing to suggest that sickle cell trait can cause sudden death by itself. And even sickle cell disease has a protracted pain course, a protracted hospital course that leads to death. So sickle cell trait should never be used as a cause of death in an individual who dies during an altercation in custody.
So that begs the question of why. Why are deaths in custody treated differently than deaths outside custody by people in your own profession?
You know, that's a really good question. Some will proffer that it may be institutional and structural racism. Some would suggest that it is a culture and philosophy that is based in how medical examiners were taught in fellowship. Some may suggest that it's because of the relationship between the medical examiner, coroner, and law enforcement, that there's too much of a dependency and a fear for calling homicides on individuals that they know and have to work with. I don't know the answer, the complete answer to why it happens. I know that there's a need to understand why, and I think that we can understand why if we take a closer look at these cases.
Now, have you been taking a closer look at these cases, and what patterns do you see?
It's hard to take a closer look, Josh. There's nobody counting these cases. There's no one counting it. There's no reliable data that's coming out of the Department of Justice. The Centers for Disease Control is not tracking these cases accurately, whether they're the natural cases that are dying from hypertension and diabetes, from poor conditions in the prisons, or suicides from poor monitoring, or homicides secondary to law enforcement force. There is no accurate data being collected. And so my view of it is from the fact that I do cases, right? I do second autopsies on individuals that die in custody. And I'm seeing the above. I'm seeing where altercations are called accidents and undetermined. I'm seeing where improper measures are being put forth to protect these citizens from harming themselves when they are at risk of suicide while incarcerated. And quite frankly, it's funny because I just did a second autopsy on someone who died in custody. And many of your viewers may be thinking that that person was a Black man. Well, he wasn't. He was a white man. And I think the country needs to understand, your listeners need to understand that this is not just a them over there issue. This is an issue of anyone that's coming in contact with the criminal legal system for any intense period of time. We need to understand if they die while in custody, then the citizenry should understand why and be studying how we can prevent those deaths. Josh, you love setting me up, right? Set me up for the great finale, right? I've been calling for, and it's just great opportunity to be talking to you. I've been calling for a checkbox on the U.S. standard death certificate. That checkbox is critical.
So
that
what could be
checkbox
done
is
to
going to
get
allow
better
for
data?
us to capture the information that we want to capture. The reason why we know women are dying during childbirth is because there's a checkbox on the U.S. standard death certificate. This checkbox should say deaths in custody, yes, no, or undetermined. If we do that, then we'll have a public health objective measure of categorizing and tracking those that are dying while in the custody of criminal legal system.
So you have seen case after case that really raise your concerns that there's a problem in how deaths are categorized, but it's really not possible to see the scale of the problem until you look. And looking requires making sure that you identify deaths in custody, which could be done easily with this checkbox.
Absolutely. We have a checkbox for motor vehicle collisions. That's why there's these Vision Zero initiatives across the country. We know whether or not it's a pedestrian struck, whether or not they were a driver of the vehicle, whether or not they were a bicyclist. We know that because it's a checkbox on the standard death certificate. We know about infant mortality because of how the death certificate is used. Fatality review teams that have been really a mainstay in public health inform so much. And we know that because we built a public health infrastructure around some of these deaths to understand them.
Right. If you knew which deaths were in custody, you could bring people together to really look at them, understand what's going on, and understand how they could be prevented.
Centers like yours can have a division whose job it is to look at deaths in custody from injury and disease and see across the country where things are going well and where things are not going well, who's suffering and who's not, and really decrease the morbidity and mortality within the communities at most risk.
How's that going? How's the campaign to get a checkbox on the death certificate going?
Josh, I got on your show. Right?
But it's a very convincing. I'll tell you, I am on board. I am completely convinced. I think this absolutely makes sense. It's very persuasive, but I wonder whether you're really getting traction with the people who get to decide what goes on the death certificate.
Well, that's a good question. I need anyone who's listening that has access to their local public health. This can go on the local death certificate. We don't have to wait for the U.S. standard to change, even though it's ready to be changed. It hasn't been changed in over 15 years. The pushback is that we can't put the box on it. It'll take too long. And I think we change it by putting it on our own local. I did it here in DC when I was the chief medical examiner. So we have a box of deaths in custody in the District of Columbia. We need this across the country, locally. And then we need to ask NAPSIS to call for it on the U.S. Standard Death Certificate. And we need NAPSIS, which is the Vital Records member organization of registrars. They really have a big voice to the National Center for Vital Statistics. That National Center for Vital Statistics under the CDC, we should be calling them, emailing them, say, hey, put a checkbox on the U.S. Standard Death Certificate that says deaths in custody. The National Medical Association, which is I'm a member of, we've developed a whole learning tool that we can roll out to help certifiers of death utilize that checkbox appropriately. We're hoping to get traction with podcasts like this and individuals that have access to really promote it.
Dr. Roger Mitchell, thank you so much for joining our podcast to talk about these very important issues. Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.